Hi, everyone. Welcome to the Collateral Global podcast, where we explore the legacy of the COVID-19 pandemic on science, society, and public health policy. I'm delighted to have my guest, Nat Malkus, with us today, who's a senior fellow and deputy director of educational policy studies at the American Enterprise Institute in Washington, D.C. He's a leading national expert in the U.S. on educational issues, including how American schools and American children responded to COVID policies and the pandemic in general. I came across Nat's work actually in a March 2024 New York Times article entitled "A Crisis of School Absences," and I reached out with him to him to speak with us today. So thanks so much for coming on the podcast, Nat.
Yeah, you bet, Kevin.
Great. So let's just jump right in here. So that New York Times piece, can you give us a sense of the data that you contributed to that piece, and also broadly your research on the impacts of COVID school closures on U.S. children and the school system?
Yeah, there's been a lot underway. We at AEI started right in March 2020, collecting data on schools' responses to the pandemic. Have not yet stopped. I'm a little tired of it, quite frankly, but lots of work. The latest work that we've been focused on is chronic absenteeism, which in America is defined as the percentage of students enrolled that miss 10% of the year or more. It's not a great measure, but it is a measure that we have widely, and it jumped dramatically over the pandemic. It was about 15% before the pandemic started in 2018 and 2019, so that's about 1 in 6 kids. And it jumped to about 29% of kids. That's an increase of over 90% by 2022. And even more alarmingly, it's coming down. That's good. It's not coming down very fast. That's bad. That's the data that was at the center of that New York Times piece.
Okay. And there was also some discussion around sociodemographics, right, in the piece itself. So can you give us a sense of what that data tells us?
Yeah, absolutely. So there's two things to hold in your hand at the same time to understand what happened in the chronic absenteeism world. Before and after the pandemic, students who had more disadvantage, as we usually sort of call it, so minority students, poor students, lower performing students, or students in lower performing districts, they had higher chronic absenteeism before the pandemic and after the pandemic. Right. So for whom is this absenteeism crisis the most dramatic? Yes, it's for disadvantaged students. However, the change during the pandemic was relatively even. So if you were a little better, you're still about 90% worse 3 years later in the pandemic. So the proportional increase is very even. So the problem did get worse for everyone. It's just still worse for disadvantaged students.
Right. And why is chronic absenteeism such an important issue? Why do you focus on that as a metric of, let's say, the broad health of the school system nationally?
Yeah, I mean, there's a lot of ways to answer this, and I can go down to the weeds, but the basics are, school is good for kids. It's where they learn to do things both academically, also behaviorally, and inconsistent attendance at school gets you less of what school gives you. And it also means if you have a lot of kids that are attending inconsistently, then school just doesn't run as well. It's just a less efficient sort of machine for all the things that it does. And I think that's bad.
Yeah. And there's also obviously other research on the effects of school closures, right? Have you been involved in other studies or using at least other metrics, let's say, to get to terms with the effects?
Yeah, I mean, Kevin, at the beginning of the pandemic, we did the first nationally representative data on what schools were doing that first spring when they shut down. The next year, we decided we needed better data. So we gathered data from 8,600 public school districts that cover 90% of public school students every week of that year to figure out who was closed and who was open the longest.
Yeah.
That's data is still the best data in the US. We've tracked masking the next year at the same district level, again by week, to sort of measure how the CDC's arguments on masking worked or didn't in many cases. We've seen differences in enrollment and by those other factors, and we're still trying to gather data on the multiple aspects. Look, COVID was the biggest shock to public schools. Certainly since the last pandemic over 100 years ago,
Right.
probably even bigger then. And, it takes a long time to catalog all the fallout.
Yeah, and it's helpful to put this in global perspective. So UNICEF calls school closures an intergenerational inequality shock, right? Because you have long-term impacts on income for this generation, the COVID generation or the lockdown generation. Some of the research out of UNICEF, just to give us our listeners a global perspective, 1.6 billion children in 190 countries missed on average of 141 days of school in 2020. Okay. For 771 million students, they lost 1.5 years or longer during the pandemic. And the UNICEF data on this estimates a 13% increase in what they define as global learning poverty, which is a metric based on reading at a certain age. So the issue that we're talking about here, it's a massive issue. And it's good to talk about it in the US, which is quite important. There was a study recently, I forget exactly the think tank, and hopefully you're familiar with this, that estimated, because another impact is dropouts, right? And so they estimate 150,000 extra dropouts across 21 US states. Are you familiar with with the study that I'm talking
No,
about?
I haven't. I haven't tracked that, and there are a lot of fallouts from the closures. One of the things that is interesting about the chronic absenteeism, also from an international perspective, in Britain, they're having trouble in Scotland, Wales, UK, Australia, New Zealand, basically wherever they're measuring this, the absenteeism is up. And there are differences by closures. Districts that were closed longer do have larger rises in chronic absenteeism, but it's not the main factor, right? Like it is worse, full stop.
Right.
But it's actually a problem that we also see in places that, whether all students went back, whether they were open or not. So it really is part of, the problems linked to closures and the problems linked to just our general response. And so figuring out exactly how to respond to these things is vital. But I really think that coming up on this next school year, for chronic absenteeism, we really need to hit it hard, lest these things settle into the new normal, the new baseline, which I think would be a disaster.
Okay. And there's also lots of other effects. So mentioning Scotland in the UK media a couple of weeks ago, there was a bunch of national stats on behavioral problems in schools, right? Then you also have motivations among teachers. So can you just give us a sense of maybe of some of these other effects that you've been tracking?
Yeah, in different places, different nations will have different abilities to gather that kind of data. And quite frankly, in the US, where schools are run by states, our data on sort of behavior and so forth is just very fractured. But occasionally we do get looks into the school with survey data and so forth. And it's troubling, right? We've seen some pretty troubling data. Quite frankly, I'm data hungry. I want more data to understand what's going on. But the things that I've seen are certainly not super positive. And I think it's going to really take a groundswell to turn this around. Some of the problem that I think we see in America is that a lot of parents are primarily just glad to have their kids back in school. They don't observe, there is this deficit from COVID, and they're not that dissatisfied. And if they aren't awake to the challenges that their kids are facing, because they're not maybe as glaring as they would need them to be to act, then I'm worried that we don't have the motivation to respond.
Right. So what are some things that states or the federal government are doing to try to address these problems? Right, we're now in, we could say, a recovery phase. If you think about typical disaster cycles, right, of this pandemic, are you aware of some federal programs or state programs that are being successful to address, let's say, chronic absenteeism or some of the other issues?
Again, in the U.S. context, where states really run things. And then within states, districts run them. So it's just lots of loose linkages. The federal government doesn't have that much purchase on affecting chronic absenteeism. So they are occasionally having sort of, events on it and so forth. But whether there's a coherent program that they could launch is an open question, and they aren't doing one now. They have sent out a lot of pandemic relief funding that went
Right.
out some time ago and is sort of winding down.
Okay.
There are no real plans to increase that or add more to it, and there's not that many calls for it because a
Okay.
lot of that money seems like it wasn't actually spent at least well enough to make the
Yeah.
case that we
Yeah.
need a lot more. There are
Yeah.
states that are doing
Yeah.
things, but there's 50 of them, Kevin. So they
Yeah.
do very different things. Some of them are taking it seriously and they're making a difference.
Mm. Yeah, one of the problems with the emergency funding is you have these buckets that go to the states, and then they feel like they have to use it by a certain period, deadline, and it's not always targeted or thought through properly in terms of, okay, how can this program, really address the problems that we're having? I mean, would you advocate for a federal program? Is this something that you've thought about, or maybe a different model which motivates the states to address this in a more concerted way? Do you think we need to have a post-pandemic educational recovery initiative, or what do you think?
We actually I hosted a debate a couple of weeks ago on this very topic. Was the pandemic funding enough? And you can listen to that debate on the AEI website if you or your listeners are interested. Look, my basic contention is the last money that went out for pandemic recovery went to a lot of different places, and we didn't get a lot of return on that historic investment.
Right.
And until I could see a plan that would ensure that more federal dollars would get a much better return on investment, then I would be reticent to support such a plan. And it's very difficult in the US context because there's just so many links in that chain between federal action and that has to go to states and to schools or to districts and to schools, and the links in that chain have a lot of loose links.
Right. Have there been any positive consequences of the school closures? Because I think there's a growing number of parents and nationally policymakers, people in the public health community who realize we really got this wrong. Like, I think particularly of a Lancet article that was published in April 2020 that summarized the evidence on school closures and COVID, and essentially saying we do not need to close schools. And this is very early on in the pandemic, and we saw extended school closures in some states. Right, obviously, 50 states, people we reacted differently. Do you think there's a growing sense in the U.S. that school closures were a wrong policy kind of pathway or a mistake, or what's your sense of that at a national level?
Yeah, I think, part of this was in America, we polarize things very rapidly. And again, we have certainly done this with school closures, which were very politically polarized. I do think that sort of the historical view on this is shaping up to a pretty clear consensus that by and large, school closures were overdone. They were overlong, and the danger to children was underappreciated. Whether we learned that with enough sort of salience and certainty to avoid the inevitable polarization, should we face another event? I'm worried about that. And the other thing that I'll worry about is I don't think that our public health authorities in America and the CDC did themselves many favors. I think they eroded a lot of their authority. And I think that a better functioning CDC would be important and also harder to bring to bear anytime in the near future. So I think there's a lot of shoring up on that end to hope that we actually learned from what happened.
Has there been an evaluation of the major American policy organizations? So I'm thinking the American Pediatrics Association, the CDC. I mean, you can envision probably 5 or 6 of these, nationally recognized agencies, including the teachers union, which they're actually the ones who pushed for the longer school closures in many regards, and we can talk about that a little bit. But has there been any effort to honestly evaluate the pandemic experience for children, and particularly around schools in any way?
I don't think there's a particularly concerted sort of national effort by any means. Again, the polarization just certainly makes such a disinterested pursuit of truth difficult, right? Because there's many interests at play. I have looked at some of the particular things. I have a particularly scandalous take on the CDC's masking policies, which I think were just terribly handled and You
Oh
can use
yeah.
their own data to show that. I mean, I have used their own data to show that their absolutist metric or rationales on that were
Yeah.
not justified. But whether there's a clear and comprehensive take on this, there's no one place to look, and not a
Okay.
lot of effort put into it.
Interesting. I mean, so I noticed that you were you provided testimony to the subcommittee, I think, or some can you give us a sense of what took place there?
Yeah, I testified at a couple of different congressional subcommittee hearings over the past year. One on just how schools responded to the pandemic, mainly with the closures. Another one that primarily dealt with the current issues and whether the closures have led to test score falls and absenteeism. Look,
Yeah.
there's a little bit of a playing down of that, and look. I think a big part of this in the congressional hearings was we have huge problems and we need to bring resources, and more than resources, the resource that we need the most, in my mind, is not money. It is focus and attention and intensity to bring those responses to bear. And much of my efforts in that congressional testimony was to, go to a place where the bully pulpit can really sort of say, yes, we do need to focus on this. Because I think it's teachers, students, parents that are really the most important players in this game to turn things around for this generation of students.
So final question, Nate. So if there was a repeat of COVID, let's say in a year, another respiratory pandemic, let's say broadly kind of similar, do you think the nation would respond differently in terms of how we're treating schools and engaging with schools?
Well, I'll give you a no and yes. So on the one hand, I think the sort of polarized nature of our response, and also the polarized sort of common sense about what makes sense, I still think that those differences in opinion are pretty pronounced across the country. So I think we'd see similar patterns. My hope is that we wouldn't have gone through this pandemic and learned nothing. I think that to some degree, there would be more limits on the length of time that schools would be closed in response to something similar, and that there'd be a more sort of active and thoughtful response. When we see actual case rates go up and threats to the local area, we respond and then we reopen as soon as possible. I think that there is some recalibration there. And Kevin, I hope we don't have to find out.
Great. Thanks so much, Nate, for joining us. It was a pleasure, and thank you.
You're welcome.